Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters, a comprehensive chat with the Islamic Medical Association. My name is Dr. Shoaib Wadi, and today we are going to be discussing the role of the pharmacist and rational and proper use of medicines. My guests today are Huzaifa Khan and Roshanara Saluji. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome.
Walaikum salam wa rahmatullahi wa barakatuh.
As usual, before we get into the crux of the matter, we're just going to discuss a few words of advice and some tarbiyah, just to get some idea of what the show is about. So today I want to discuss one of the sunnahs which the Prophet ﷺ, it's a well-known hadith of the Prophet ﷺ, reported in Muslim, that the Prophet ﷺ is reported to have said, "It is enough for the son of Adam to have just morsels of food to keep his back upright or straight. But if you have to eat more than that," and everybody thinks that this is part of the sunnah, that this is what you should do, then 1/3 for food, 1/3 for water, and 1/3 for air. So we can see that the Prophet ﷺ actually said you should eat just enough to keep your back straight. So moderation, the smallest amount that you need. If you need to eat more, even then you should eat in moderation, not exceed 1/3 for food, 1/3 for fluid or water, and 1/3 for air. And we know, we've discussed this before on the show, this is one of the simple sunnahs that the Prophet ﷺ has taught us, which has so much potential benefit when it comes to the health of the human being. It teaches us self-restraint, it teaches us to control our appetite, and at the same time the benefit of doing that is to prevent many of the lifestyle diseases that we see now, the obesity, diabetes, hypertension, chronic cholesterol problems, heart disease, and many other ailments are related to just the poor way that we eat. There are many other sunnahs around the way of eating, and we know that Allah subhanahu wa ta'ala has made has regulated our eating in a way where we only allow to eat things which are halal and which are pure. So that again is a great example for us in terms of how our diet can regulate our health. So that was just a little bit of an introduction. To get into that, we're going to discuss the role of the pharmacist in medicines with Huzaifa and Roshanara. Welcome once again.
Jazakallah.
Okay. So as I mentioned, I think in today's day and age, many people are not really sure what the pharmacist is, what he does. Is he just a guy standing behind a counter, a glorified shopkeeper, went to varsity, didn't get into medicine, so did pharmacy, and now he's just stuck in the pharmacist? Let's start with Huzaifa. Huzaifa, what's the role of a pharmacist?
Okay, so I think, as you say, the role of the pharmacist has been totally misunderstood, especially in the South African context, and especially from where we are currently in pharmacy. Previously, with private pharmacies, a lot of people were almost business people, so they used to run the pharmacy almost as a business. Right. But in the current setting, especially in South Africa, with a lot of changes that are happening, the pharmacist is much more involved in the holistic care of the patient. Right. So the pharmacist is involved clinically in ensuring that the patient gets the best treatment at all times. Right. It also needs to be cost effective to the patient, and it also needs to have a broader effect on society. Right. So that it's not only the patient's health that's being affected, but it's in fact that the society whose health and welfare is being looked after.
I mean, you could say that for every health professional, that if the health professional's perspective is that his work is not just a business, but needs to impact society and change the way people's health develops or improve people's health, then it changes the focus of what the health professional does.
Yes, definitely. In fact, with the health professionals, I think also when it comes to pharmacy, that you're involved very deeply with the patient, because a lot of times the pharmacist gets to spend extra time with the patient. When the patient comes into the pharmacy, you almost build a personal relationship with the patient. You get to build a relationship not only with that patient but with their family also. A lot of times they discuss what else is happening in the family. So you build a deeper relationship with the patient. You get to spend more time with them, and you also understand certain circumstances that the patient is in when it comes towards their finances, when it comes to their preferences, especially for example in the Muslim community with regards to halal medication and specific requirements that patients want when they come to collect medications, or when you issue medications to the patients.
Yes. Roshan, are you going to go through what the training is for a pharmacist? What do you guys need to do to become a pharmacist?
So The degree is 4 years, and you get your Bachelor of Pharmacy degree.
Right.
You then have 1 year of internship,
Right.
and this can be done in any sector, the private sector, the public sector, or the industry.
Do you apply, or do you get
In the private sector, you'd apply. Even through the government sector, you apply. However, you list your preferences, and then they would place you in wherever you allocated.
Right.
After your year of internship, you've got 1 year of mandatory community service, and this you haven't really got much of a say over. You can again list your preferences, but you are allocated, and there's actually there's no structural way that you're allocated.
And this can also be in the private or the public sector, or only in the public
for
sector?
Community service, you're only placed in the public sector.
Okay.
The whole idea of community service was to service the government sector, and more so the underprivileged or the rural areas.
Okay. And then through your training, obviously you learn about the challenges that face people regarding the use of medication and so on. Can you tell me, from the people that come through to the pharmacy, what are the biggest challenges or obstacles that you encounter in terms of how they use their medicines?
I would say patient compliance is a big problem. Okay. So a lot of people have ideas, and they hear from friends and family about how to use medication, what medication to use, sharing of medication.
Social media.
Social media especially, and I think in this day and age, the patient is a lot more informed. They use University of Google, exactly. And so they look up all types of medication, and they self-diagnose, they know what they want, and they'll ask for it, or they hear from a friend or family, this is good for this indication, but they actually don't have the background. That can only be prescribed by somebody who's trained to prescribe the medication.
So let's go through the process as it should occur. So there's some medicines which you can only get via prescription, and there's some medicines which you can get over the counter. So what's the difference?
You've got a schedule of medication. So Schedule 0 to Schedule 2 can be over-the-counter medication. Anything that's Schedule 3, right up to Schedule 6, is by prescription only. However, the pharmacist can dispense Schedule 3 medications without a prescription in acute cases.
Okay. So, Huzaifa, let's just get back to you. So the process as we're describing, so say you need to get a prescription medication, what's the steps that you need to follow?
Okay, so it depends on the patient's condition, right? So if the patient, of course, there's two sectors now. You're going to have to look at the public sector and the private sector. So when looking at the public sector, generally a person is going to come into the hospital or clinic, and the doctor is going to see them. Basically, if they need to get specialist treatment, they'll be referred on to a specialist in the hospital. And there's two parts in the public sector where you're going to have your inpatients and outpatient department. So then generally in the public sector, this is where a lot of people have, issues with the pharmacy. They say there's long queues and they wait a long time.
Especially for outpatients.
Yeah, especially for outpatients. So the doctor would do an evaluation on the patient and decide what medication the patient needs. The patient comes to the pharmacy, and then when the patient's in the pharmacy would evaluate the prescription, see everything is fine, and give out the medication from
But I think that's an important point that you brought up there, because I think people are not really aware. They think you're just giving the script to the pharmacist, and the pharmacist just takes out a calculator and like a little pen and just counts the pills and then puts them into a bottle, and that's really very easy. Anybody can do that. But the job of the pharmacist is then to go through the prescription.
Steps involved when you receive a prescription. So you first have to evaluate the prescription for legality as well as validity.
So make sure it's valid, that somebody's not made up the prescription.
Yes, and not forged scripts, especially with some restricted drugs.
Is that a big problem?
I would say it's a big problem, especially in certain communities. You do get forged scripts.
And how do you pick it up? What type of things do you see?
Well, like I said, there's particular aspects that you'd require in a prescription. So a Schedule 6 prescription would require it to be written in a particular way. So you need to have the quantity of the medication written out in words and figures. And sometimes the forged scripts, there's a bit of an anomaly, and you'd recognize it. And especially if you know the prescriber and you can see that the writing is not particularly the same.
So
that's how you pick it up.
Neatly legible. It's probably not from a
Definitely.
I mean, so let's just go through the schedules, because we made it before we get back to this issue, because I think it's going to come up again and again. So what type of medicines would be like Schedule 6? Are those opiates, painkillers, addictive medicines?
Yes. So the opioids, morphine, pethidine, those are Schedule 6 drugs.
And those must be controlled and kept in a
Kept
cupboard?
under lock and key, and all dispensed prescriptions are entered to in a specific drug register, kept
so
on the
it must be
premises.
fully controlled?
Yeah,
Yes.
full control. They're locked away. They're specific. In fact, they evaluated a lot of the, even the medical aids come to evaluate and see whether you are giving it out according to prescription. So there's a lot of regulations put in place to ensure that not even the pharmacists or other healthcare professionals can abuse these medications. In fact, even if, like for example, if in hospital, if an ampule breaks or so, an incident has to be made about it. And yeah, and in fact, if something, even in the hospital, if it goes missing, it's taken as a severe incident. So yeah, it's not something that just
because obviously there's a potential for abuse. Somebody could be selling it, and there's a market for it because people use it as
and because it's available, especially
recreational drugs.
And then, in fact, with the other medications, currently there are registers also, which most of them, in fact,
this is also Schedule 6. Or other
Schedule
schedules.
5. So
Other
specified
schedule.
Schedule 5
So what's the
is
difference between Schedule 5?
Specified Schedule 5s are your anxiolytics and tranquilizers, but there's also potential for abuse with these drugs.
And they're also addictive potentially, yeah?
Yes, addictive as well.
Okay.
And then you get Schedule 5 drugs, which are the also includes tranquilizers, but the ones that are not as restricted as the specified Schedule 5s.
Okay. And then Schedule 4, 3, and 2? So you need a script for anything above Schedule 3, you said,
yes, anything above Schedule 3. So basically your antibiotics are Schedule 4, your antihypertensives, and a lot of the chronic medication for chronic conditions are Schedule 3 and 4.
Okay. And then Schedule 1 and 2 are usually what we call over-the-counter
medication. Yes.
All right. Okay, so we were discussing the validity of the script. So you make sure the script is valid, that it's legal, and then the next step was?
Then you read and evaluate the prescription.
Right.
So if there's anything that's unclear, at that point you'd contact the prescriber to, for example, with the writing, if you can't identify an item, you call.
Well, that's very important because, I mean, from personal experience, I've had patients where the pharmacist has made an error. But I mean, obviously, you can't blame the pharmacist. The error is probably a combination of the doctor and the pharmacist. If the doctor's writing is not legible and then the pharmacist didn't check it, they can easily prescribe the wrong medication.
Yeah, so it's very important to make sure you've got the right item at the right dosage, the right frequency for the right duration.
Okay. And I mean, I think what we often miss in this is that I mean, doctors and pharmacists are not working in a vacuum. They're not there to dictate to patients. We're not like, the boss, you must do this. They're really, in prescribing and taking of medicines, there should be a partnership between all these members of the team.
Yes, in fact, especially currently in the current setting of pharmacy in South Africa, a real buzzword is clinical pharmacy. Yes. And you see a lot of the students that are graduating want to get into clinical pharmacy and, want to be involved in that, either want to do masters or, want to do something where they'd be involved in a lot of clinical work. So you're not necessarily, clinical work and research. So you're not necessarily dispensing to a patient in the pharmacy, but you're also going on ward rounds, you're interacting with the doctors and discussing with the doctors whether the treatment is appropriate.
And that's really valuable. I mean, from personal experience, again, I can tell you that to have a pharmacist on the ward round is really very useful. They can tell you what type of medicines you have in stock. And sometimes they can suggest something which, I must tell you that contrary to popular belief, doctors don't know everything. In fact, most doctors don't know that much at all. We have a fairly restricted scope of practice. And I think if you had to look at it, I'm sure you guys can tell from experience that some doctors prescribe the same things every time.
Yes, doctors have their protocols and their regimens and they stick to that. And that's why we sometimes advise them that for a particular patient, this would be more appropriate.
Yes.
Or in combination with other drugs that a patient may be on, something else would be more appropriate.
And that's part of reviewing the prescription.
Yes.
And I think that's also why it's so important to, rationally prescribe, that each patient is evaluated on a specific case basis. Yes. So even though you have your protocol, which, for example, a lot of surgeons have protocols in which they follow, but each patient is individual and has different cases. So, yeah.
Now, I mean, the protocol obviously works in 90% of cases, but there'll be those cases where there's a problem. The person is allergic or is on another medication which will interact with the medicine which the surgeon has prescribed and so forth and so on. We've picked it up as well. So I think that's an important thing which people need to be aware of. And what I was getting to when I said it's a partnership is that patients also need to know their own medicines. Yes. And I mean, we get into a bit more detail about how patients should interact and know their medicines and what the role of the pharmacy is in that respect when we get back after the ad break. Also, inshallah, we will open the lines for people to call in with their questions regarding medication, the use of generics, many other aspects around medicine use. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to Health Matters, a comprehensive chat with the Islamic Medical Association. We've got Roshan Arasaluji and Huzaifa Khan, two eminent pharmacists. I forgot to mention earlier that Huzaifa is actually the chairperson of our Gauteng branch, so he's very heavily involved in the IMA, and we're going to try and pester him and see how we can get some more pharmacists involved in the IMA as well. So, but just to get back to where we were discussing how patients should take some responsibility and have some understanding of their medicines. But I mean, obviously, as I mentioned, it's a team approach. So do you think doctors and pharmacists are fulfilling their responsibility in educating patients and what we should be doing?
I think there's two, like I've said also with regards to the public sector and the private sector, there's differences that happen. So with regards to the public sector, to a certain extent, that's not happening at all. There's not much interaction between the pharmacist and the doctors.
It's like they're just churning out medicines.
Yeah. So in the pharmacy, the pharmacist doesn't even get to spend a lot of time with the patient.
Yes.
So the pharmacist, once they evaluate the prescription, they get the medication ready for the patient, they give it to the patient, and they just almost, to get through the queue, they have to rattle out the information. And
what are the problems? Is it just the workflow or just the sheer numbers of people?
I think currently in our public sector we have it's a volume. The capacity, we don't have the capacity for enough pharmacists. I mean, just recently, there was the issue about pharmacists not being placed for community service.
Yes.
But there's a difference of opinion about that, because some of the areas where the government is trying to assist is actually put pharmacists here, and pharmacists not always want to go to those specific areas. So we do have the challenge. So sometimes the pharmacists and pharmacist assistants are under pressure in that they need to provide this medication to the patient and make sure all the patients receive medication, but at the same time need to counsel the patient.
So what's a pharmacist assistant, just to interrupt you?
Okay, so then a pharmacist assistant, currently they're going to move over to a pharmacy technician. So you get a pharmacist assistant and a pharmacy technician.
Yes.
Basically, they have done a bit of a shorter studies with not as many pharmacotherapy and pharmaceutics
so it's
studies.
A degree or diploma?
It's a diploma.
It's a diploma, okay.
So they basically are allowed to assist the pharmacist in certain cases, but they also have restricted access to certain medications and are not allowed to counsel patients without
without a pharmacist.
Yeah, without the pharmacist
present. It sounds like there's a significant need for training and more people to be involved in being pharmacists and pharmacist assistants, particularly people who are willing to work within the public sector, especially in areas of need.
Yes, there is a great need, and in fact also the government has started a program where they're actually getting pharmacist assistants trained, and in fact a lot of the private sector has jumped onto this and are training pharmacy assistants, and basically with the pharmacy assistants coming, in fact in a lot of the rural clinics there's actually the pharmacy assistants who's running the pharmacies. The only difficulty comes along where the pharmacist assistant doesn't have as much pharmacotherapy or pharmaceutics knowledge to be able to counsel the patient.
Okay, I understand.
Which, and then when coming to the private sector, there's and the challenge is that a lot of times people in the private sector, they're busy, so they don't necessarily want to listen to the pharmacist and get the full counseling.
Or even the doctor, to be honest. Yeah.
So,
and sometimes the doctor is busy, doesn't want to have time. He's expecting the pharmacist to do it.
Yeah.
Or he's not expecting anybody to do it.
So then that comes where there's a lot of confusions in the way that patients use their medication, and then the patient compliance. A lot of times when for example you want to give a patient, there's a prescription that comes in and a patient requires an antibiotic, and for example the patient has to pay cash or their medical aid's not covering for it, then the patient is they're like, no, I still have that medication at home, leave it out. I don't. They don't want it.
Take it.
They didn't complete the course. They didn't fully use it, and then they want to use the same medication that they had left over.
Now, I mean, obviously patients will sometimes have side effects from medicines, and they have a certain expectation the medicine's going to do this, and they have a side effect or do something else. So how do you mitigate against that when the patient comes to us?
So I would say pharmaceutical care in terms of counseling is the most important step in the dispensing process we mentioned earlier.
Okay.
So explaining to the patient exactly how to use the medication, when to take it, for how long to use it, and then just giving them a brief summary of what side effects they can expect to have while they're on the medication, so that it improves their compliance, so that they're not scared.
Something you're not surprised by it when it happens.
So just basically informing them and making sure that they understand the importance of why they're taking the medication, so that they will take it for that indication for the specified amount of time. And then also very important, for example, when it comes to antibiotics, informing them that when you're done with antibiotics, if there are any left over, or for example syrups, to discard it, not to be kept to be used at a later stage.
Yes, yes. I just want to remind our viewers that the lines are open, and if you have any questions regarding how you use your medicines, how your medicines are prescribed, and any interactions that you think may be related, or side effects which may be related to your medicines, please feel free to call in, and then our pharmacists will try and help you to answer those questions. So the numbers are on the screen. So just to get back, we were talking about patients' expectations, how to manage the side effects, or explain to patients about the side effects. There are some medicines, for example, if you have a full prescription of 4 or 5 items, you may find that some medicines are not really necessary or are superfluous, or some are nice to haves. Do you sometimes explain that to the patient?
Yeah, in fact, a lot of times you do get that polypharmacy where doctors prescribe more than the patient actually requires.
Yes.
And sometimes it comes from the doctor, and at other times it comes from the patient who, you know,
Okay.
like...
I'm going to interrupt you because we have a caller. Assalamu alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello? Hello? We can't hear.
Can you hear me?
Assalamu alaikum. Can you hear me?
Hello.
Hello. Assalamu alaikum wa rahmatullahi wa barakatuh.
Maalaikum salam.
How can we help you, brother?
Can you hear me?
Yes, we can hear you.
Can I come on the line?
Yes, carry on.
Okay. I would like to talk to the pharmacist about when you enter the pharmacist, like the desk pharmacies, pigs or whatever.
Yes.
Now you select some, ask about the supplements.
Yes.
Isn't it the duty of the pharmacist to ask, or whoever is serving you, that what other medication are you on, like chronic medication? Because these supplements can interact with your chronic medication.
Yes, that's actually an excellent point. I was actually going to bring it up later in the discussion.
And one more comment.
Yes.
Gee.
Carry on.
Okay, the one comment is that it's just on something on a lighter note. A guy asked me, he says, he can't read the doctor's handwriting. So you know what's written there is written there on the script saying that I've taken 70% of his money, now he's taken 30% as a pharmacist.
Jazakallah, thanks for that. Normally we take 80% and we leave 20% for the pharmacist. So that's a good one. But I mean, let's get back to the serious point of the supplements. In fact, it's not just supplements I was going to bring up. So there's lots of over-the-counter medicines which people don't necessarily have to ask a pharmacist about. Supplements, even herbal medicines and medicines from hakims, from traditional healers, which may or may not interact with medicines that people are taking.
Yeah, in fact, that's an excellent point, because a lot of times these things are available over the counter or sometimes in the front shop, especially with the herbal medication. Okay. And a lot of them are not actually evaluated by the Medicines Control Council.
Yes.
And in fact, now the Medicines Control Council has implemented a law that in fact, you'll see on some of the bottles now it says this medication with the supplements also. Yes. In fact, you'll see a lot of supplements have actually come off the market. There's certain companies who have had to stop with the claims that they've been making.
Yes.
So now you'll see on the side of the bottle, it will say this medication has not been evaluated by the Medicines Control Council.
And I think that's what people need to understand. Just because a medicine says that it's natural or that it's not, that you don't need a prescription for it, doesn't necessarily mean that it's safe. And I mean, I can tell you of many examples we've had where people have developed serious problems from over-the-counter medicine. And I mean, there's recently been a case about these cocktails. You want to go into that again?
So yes, usually a cocktail would involve a combination of medication. For example, you'd get a migraine cocktail, so it would have something for nausea and anti-inflammatory. But again, within this cocktail, a doctor may not be aware of what's within the pharmacist's cocktail, and they prescribe something that's contraindicated.
Or the patient may not be aware that something within the cocktail may not necessarily be safe for them. So for example, patients with severe hypertension or with chronic kidney disease shouldn't really be taking flu cocktails, because most of them will have an anti-inflammatory or something like phenylephrine or pseudoephedrine, which will push the blood pressure up. Patients with cardiac disease, so those lots of things like that.
And in fact, that's also another point where it comes to, the expectations that patients have with the pharmacist. Like they'll come into the pharmacy and say, just give me a flu cocktail, and then you're like, but what symptoms are you having? They're like, no, I'm just flu-like symptoms. And
it's not just the pharmacist. So yeah. I mean, one of the commonest complaints we get as a doctor is the patient will walk in and say, I have the flu. So they've made the diagnosis, and the next step they want the treatment also. They tell you what they want. Is that, I'm sure you have the same experience.
Yeah, we have the exact same experience in the pharmacy. And a lot of the patients, when you try to explain to them that, this is not something where we can just give you a cocktail and, say that you should just take this medication. We'd have to either treat you symptomatically or, treat the cause of the problem. And then a lot of times patients are like, no, but, I finished my savings. I can't go to the doctor now. Can't you just give me some preparation?
I mean, there's a pro and con to both sides. And there's a fascinating discussion. I don't even think we're going to get through all of it tonight. But when we get back, inshallah, we missed quite a few calls because, that was quite an interesting discussion. But inshallah, we'll get a few more calls after the ad break. And then we'll go a bit more into detail maybe with antibiotics and the whole story around them.
Absolute Rigging and Transport specializes in abnormal transport, rigging and machine moving. Our fleet operates nationally and beyond the borders of South Africa, offering turnkey solutions. Contact us today to start extending your possibilities.
Join the conversation. Like us on Facebook, ITV Networks. Follow us on Twitter @ITV_SA. Keep up to date with all the programming and subscribe to our YouTube channel, ITV Networks.
Imagine the next level in faucet design. Coordinated throughout your bathroom. Imagine the redesign of water itself.
Trend, Tap and Tile or Mondi. Your home, our passion.
Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back. We've been discussing issues around drugs and medicines and interactions of medicines and the use of cocktails and lots of other things with Huzaifa and Roshanara. And we were just discussing the use of different cocktails, and one of the problems that both doctors and pharmacists get is that patients come in self-diagnosed. The common one is I've got a flu, I've got a sore throat, or I've got sinusitis, and I need an antibiotic. And then they walk into the pharmacist, and as Huzaifa, as you mentioned, they'll say, I can't afford to go to a doctor now, I don't have time, the queue is too long, and so forth. And how do you deal with that?
Well, especially when it comes to antibiotics, we're facing a global problem where overuse and misuse of antibiotics is leading to increasing resistance. And I'm
going to interrupt you, Roshan. I'm sorry, man, because we have another caller, and I've been turning down the callers. Assalamu alaikum wa rahmatullahi wa barakatuh. Yeah, we can hear you, brother. How can we help you?
I just have 3 questions, actually.
Yes, go ahead.
The first one is, I'd like to know, does stopping a course of antibiotics early lead to antibiotic resistance?
Okay, that's a very good question. Yes, the next one.
The second one is, I'm also a follower of rational medicine.
Right.
So I read somewhere that Professor Mark Provenos, who was the American Thoracic Society Chair in 2010,
right,
made a statement that modern medicine is increasingly failing to deliver in its promise.
Okay.
So from your panel of pharmacists, I'd just like to know what they say and comment on this.
Okay.
The third question is, I'd like to know, is the measles vaccine halal?
Okay, so maybe let's start with the third question first, because that may take us the longest to answer. Huzaifa?
Okay, so with the measles vaccine, there's been various questions, and with regards to vaccines in general, the measles one, it's big now because of the recent campaign that the government has been running with regards to the measles outbreak that currently happened in South Africa. And in fact, the first point is that the measles outbreak that happened in South Africa was large. It was on a large scale, and in fact, one of the communities that was most affected by it was the community that doesn't vaccinate. And we found that during this measles outbreak, there were a lot of people who were afraid to take the measles measles vaccine because there was concern of porcine in the measles vaccine. So there's different aspects to with regards to the measles vaccine being halal. In fact, with regards to the porcine, it undergoes a process where the porcine actually changes its composition, and therefore in the final product, the porcine is untraceable, or there's very small trace amounts of the porcine which has changed into a different product. So with regards to the Islamic perspective, it has been, in fact, this was something that was discussed in 1995 at World Health Organization Council meeting, where this was brought up, and in fact it's funny that it's being brought up at such a late stage now in South Africa, that using the use of porcine in vaccines and in medications to a certain extent is permissible, in that because, for example, in this case, it's promoting promoting life, and for example, if you have to see the Islamic Medical Association statement, it has, in fact, it's available on the website and on various social media platforms. The Islamic Medical Association statement gives a full clarification on why the measles vaccine should be given.
Well, look, I mean, within our community, the tragedy is that there's not unity of opinion and unity of purpose either within our community. So there are several differing and dissenting opinions, and I would urge people to think carefully and rationally look at the different opinions, and also search their conscience and make dua to Allah subhanahu wa ta'ala for guidance, because Allah ta'ala knows best. And at the end of the day, the opinion of the Islamic Medical Association and many other doctors, and in fact world Muslim authorities and many ulama around the world, is that vaccination should be permissible and that the porcine element changes. There was some difference as to whether the government vaccine and the other vaccines are different. The government vaccine lists porcine gelatin as an ingredient because it exceeds its tiny amount. The other vaccines don't list porcine gelatin as an ingredient because the gelatin has gone through a process where the vaccine has gone through a process of further purification where very little gelatin is likely to be left. In fact, but they can't guarantee that there aren't trace amounts. But regardless of that, ulama have made the decision that gelatin has undergone such a marked degree of change that it can't be traceable back to the pig. There's no DNA or any other element that you can say that this has come from a pig. Let's go on to the second question. The second question, maybe I'll answer, is whether modern medicine has failed to deliver on its promise. And the question is, what was the promise of modern medicine? So I think the concept that modern medicine, modern Western medicine, promises to deliver perfect and ideal healthcare and unlimited survival is not true. I think the promise of modern medicine is to improve the health and healthcare of people in general, and it has succeeded in some areas and has failed in other areas. And I think there's a lot of diversity of an opinion as to whether it's been a greater failure or greater success. In general, over the past 100 years, the quality of life of the human beings, especially people who are relatively affluent, middle class, has been better than ever before in the history of humanity. The risk of infectious disease, of dying from infectious disease, is much less, and survival is much higher than any time previously on record, with the exception of areas in the third world and poverty-stricken areas, which still provide care to, or still are the paradigm within which billions of people live. So obviously that's where it comes in. Has modern medicine really meant that a few people live longer and better, but a large number of people still have poor outcomes and poor survival? And we won't get into some of the conspiracy theories around whether modern medicine is just out there to exploit the patients. I think there's some aspects of that which are true, but I mean that will be a difficult discussion for us. And then to discuss antibiotics, let's get to Rosh and see what she has to say about that.
So
they're shortening the course of antibiotics.
In an inpatient setting, it's a lot more ideal. You can monitor a patient's progression clinically as well as infection markers, and it's easier to determine the exact duration of an antibiotic and stopping at an appropriate time. In an outpatient setting, it's a lot more difficult. There is some data to suggest that exposing bacteria to lower doses of an antibiotic can lead to resistance. However, there is no hard and fast rule, and there's a gray area there. So I would say that you'd need to go according to your prescriber's instructions. Take it for the prescribed period of time, since there's actually no way of monitoring.
Look, I mean, there is evidence for some specific things that certain doses work. So, for example, a single dose of some antibiotics may work for some infections, for some urinary tract infections.
And some conditions require longer duration. For example, a community-acquired pneumonia, you'd require longer duration as opposed to an uncomplicated urinary tract infection.
And some of it is a guess. So Rosh is right. In a way, some of it is a guess, especially in an outpatient setting, based on the pharmacodynamics of the drug and the expected outcome. But some people may require longer duration of antibiotics, and some patients probably will get better with shorter duration of antibiotics. I think one of the big problems is some people with the flu will take 2 days of an antibiotic and they'll be getting better, and they'll think it's the antibiotic that made them better. But it's not. The flu was getting better itself. A flu doesn't need an antibiotic to get better, and so it gets better itself. You're better after 2 days, so you stop the antibiotic. So you've wasted the antibiotic. And the problem is, Rosh will tell you what's the problem with indiscriminate use of antibiotics.
So, as I was saying earlier on, the misuse and overuse of antibiotics is leading to resistance patterns worldwide. And with antibiotics, you may feel that it just affects you, but what affects one person affects the whole population, because resistance is conferred from bacteria. And
I'll get back to how important bacteria are to you. In fact, the bacteria are not just threats to you; they're an integral part of your body. And the problem with antibiotics is they kill some things which are really useful to you as well.
Yes. So they mentioned collateral damage when you take antibiotics. It wipes out your gut flora, and then you become susceptible to conditions like Clostridium difficile. So resistance is a worldwide problem. We're fast approaching a post-antibiotic era. There are not many new antibiotics in the pipeline, and with resistances that we're seeing, if we're not judicious in our use of antibiotics, we may run out of antibiotics in the future.
Yeah, maybe we can talk a bit about what we call the gut microbiome. Do you want to say anything about that?
The gut microbiome, it's basically the gut flora that we have. It contributes to our immune system.
And it's like a whole ecological system on its own.
Yes.
So it doesn't just lie there. Those bugs don't just lie there being a pest. In fact, the majority of those bugs have got very useful purposes. They produce enzymes which help with digestion. And it's been shown clearly that certain types of bugs which colonize the GI tract can be associated with certain type of conditions.
Yes, so we see a lot more of H. pylori infections these days. There's a different regimen for that. There's a lot of ulcers and people on proton pump inhibitors. It's more prominent in this day and age. And antibiotics affect all of this in the gut, and that's why it's very important to ensure that when you take an antibiotic, it's for the right reason, for the right duration of time, and only when necessary. Yes,
absolutely. Just to get back to the gut microbiome, maybe Huzaifa will know a bit more about this. One of the sunnah of the Prophet ﷺ was to put some date into which he had chewed into the mouth of a young baby. There's a name for that practice. Tahniq, yeah. And we do know that when a baby is born, most of his gut is sterile. And that gut needs to be populated and colonized with good bacteria rather than bad bacteria, because it may lead to a healthier child. And that's one of the ways to try and give that child some of the bacteria from a healthy individual.
Yeah, in fact, like you say, the microbiome it's a whole ecosystem that's there. So in fact, also that's although this is more scientific, but one of the reasons why it could be that it's encouraged that a good person should be doing the tahniq, because that person is generally going to be eating healthy foods, going to be living a healthy life. As you in the beginning of the program when you started and you spoke about the sunnah method of eating in moderation and things like that. So in that sense also a person who is relatively more Islamically inclined, would
eating
be
halal foods, looking after themselves, avoiding unhealthy practices and haram practices and so on and so on. So I think, that's just the tip of the iceberg with antibiotics. But I think some people don't understand how antibiotics work and what they do. So maybe we can just have a brief description of that, Rosh, because not all antibiotics are the same.
Yes. So there's a wide range of antibiotics. Basically, antibiotics will whichever area of your body is affected by the bacteria, the antibiotic will go and attack the bacteria. So you get bacteriostatic and bactericidal antibiotics. So the static antibiotics just paralyze and slow the growth. The cidal actually kill but they don't just kill the bacteria, the good bacteria. They also the bad bacteria. They also kill the good bacteria, and that's the danger of the antibiotics.
And I mean, obviously, there's different types of bugs. So you get antibiotics which are active against bacteria, and there's different types of bacteria. We call them gram-negative and gram-positive and rickettsia, and there's a variety of bacteria. And some antibiotics are much more effective for some than others.
So you get different types. You get broad-spectrum antibiotics, which cover both gram-negative and gram-positive, and then you get specific gram-positive and gram-negative antibiotics. Yes. So empiric treatment is always best with a broader spectrum antibiotic, but it's
because
always
you're not sure what's
causing it. So you're covering all areas, and then you also have to cover atypical infections.
So certain types of infections you can have an idea. So for example, ear infections or respiratory infections generally get caused by a certain type of antibiotic.
And again, an outpatient setting is different from an inpatient setting. Yes. So inpatient, if it's a patient who's been who's admitted multiple times, yes, you can most likely expect that they've got a hospital-acquired pathogen, right, and you'd know what type of bugs are resident in a hospital. But outpatients, it's generally a community-acquired pathogen, yes, so that's how you make your choice on empiric treatment as well.
And I mean, this is where pharmacovigilance comes in from a pharmacy side, to make sure that doctors are not prescribing antibiotics indiscriminately, because sometimes the doctor will just use the biggest gun antibiotic because he doesn't want to think, yes, about.
So an antibiotic stewardship program is very important to be well established in all hospitals in this day and age, so that you can track your antibiotic usage and connect it with resistance patterns and report it back to the doctor. So exactly, so that the doctor is aware of the resident bugs in the hospital, and that they can be kept in line in terms of their usage.
Okay. Okay, so I mean we've run out of time in this session, so we're going to go to an ad break, and inshallah when we get back we'll try and wrap up and sum up and maybe take 1 or 2 more calls. I've had to miss a lot of calls with all this talking. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back. We've been having a fascinating discussion about medicines and antibiotics and the role of the pharmacist. We're just going to go now into some of the more practical issues which many people face. 2 of the issues that I want to discuss, the one is this whole phenomena of direct medicines, where the medicines, the script is sent to a pharmacist and then, or to a pharmacy, a direct pharmacy, and then gets delivered to your home or to your place of work, and you don't have any interaction with anybody.
Okay, so there's...
okay, Maaf, I'm going to interrupt you again because we haven't been taking many callers and I've been turning them away. Assalamu alaikum wa rahmatullahi wa barakatuh. Okay, so you dropped, couldn't wait. Okay, so we were discussing the direct medicines phenomenon. Yeah.
So with regards to the direct medicines, in fact, with regards to a lot of the medical aids, they're happy to push for the direct medicines. They feel that, you know, it solves a lot of their problems from, you know, pharmacies not having stock and patients, you know, yes, especially with regards to...
It sounds more convenient. You don't have to go to the pharmacy.
Yeah, it's also convenient for the patients. They don't have to go in. The medication gets delivered directly at home. Yes. There's no queues. There's no unnecessary payments. It all goes through. They generally sort it. It's something that's, you know, convenient, especially for people that
are these medicines being dispensed by a trained pharmacist on the other end, even in direct medicine?
Yes, they are being dispensed by a trained pharmacist. There are a lot of support staff, like the pharmacy assistants, who prepare and package the medication, but it's eventually signed off and checked by a pharmacist.
Yes. And then what happens if somebody gets the medicine, they're not sure what to do with them?
And now, you see, that's why it's also very important that patients know their medication. So where a patient doesn't, and they receive it, and, you know, like a lot of times, especially with some of the medical aids, the doctor can send the prescription directly to the pharmacy. The pharmacy would prepare it, send the medication. The patient looks at the label, and they're not sure whether it's to take 2 tablets once a day or take 1 tablet 2 times a day, and the patient is unsure. So, in fact, it's part of the law that any medication that's dispensed, it should be able to, you should be able to contact the pharmacy and the pharmacist. So the pharmacist who dispensed that medication, their name should be there. It should be visible, and it should the contact number for the pharmacy should be there.
And so obviously changes, because sometimes the doctor makes changes, and then the patient's not aware of it, and then it's confused when the medicine comes.
And sometimes there may be a generic that's substituted because one of the other generics was out of stock.
Yes.
So that also can confuse a patient.
And it does. We've had many instances of people taking 2 of the same medicines because they were not aware that they were the same medicine.
So and that does happen, in fact, a lot with patients, especially with the whole government.
I'm going to interrupt you, Joseph. It seems to be you all the time. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello? Oh, I think we have a problem with our lines now. We keep losing the caller, so I hope it's not the same person. I'm sorry about that. So let's get back. So we're discussing about then the patients are confused when the medicine arrives.
The name of the generic, yeah.
Yeah.
So a lot of times, because also the government is promoting the use of generic medicines, especially because.
So let's get on to that.
Yeah. So currently in South Africa, it's part of Pharmacy Council rules, and also the law of the government is that we should actively promote the use of generics.
So what is a generic? Maybe just to, I'm sure most of our viewers know what it is, but just for those who may not know.
A generic drug is a drug with the same active ingredient that has the same effect, same safety profile as the originator. It's just cheaper in price.
Okay, but from my experience, and I'm sure from your experience, there are a few drugs where the generic is not equivalent to the originator.
Well, all generics, to be registered as a generic, need to have bioequivalent and have the same bioavailability as originator. But yes, sometimes there may be one or two from patient experience and from doctors' experiences that don't quite match up to the originator.
I mean, let me give you a classic example is Lasix. So I'm sure many of you have come across that, where the original Lasix works much better than, we'll get back to that now. So we have another caller. Hopefully the calls work this time. Assalamu alaikum wa rahmatullahi wa barakatuh. Wa alaikum salam wa rahmatullahi wa barakatuh. How can we help you, brother?
Dr. Wadi has a question to Dr. Wadi and the pharmacist.
Yes, please go ahead.
I would ask a question about, one question about the superbug is resisting most antibiotics. What's the situation between another 5 times, 10 years time, or 15 years time? Any help me?
Okay. Okay, can we answer on the TV?
Yes.
Okay, Jazakallah. So that we were alluding to that earlier. So he says superbugs we're getting which are resistant to almost all antibiotics. What's going to happen in the 5 or 10 years time? And I think you mentioned that earlier in terms of what we call a post-antibiotic era.
Yes. So there's a lot of something called carbapenemase-resistant Enterobacteriaceae, CRE, and this is the superbug that we're seeing in many hospitals. I think in the government hospitals, it's not as well documented as in the private hospitals. And we actually have reverted back to an antibiotic that was used years ago called colimycin. And the reason they stopped using is because it's so nephrotoxic. But it's the only drug that currently works for the CRE. And
so nephrotoxic means it's dangerous for the kidneys, amongst other things, the nerves and brain and so forth and so on, but it's really toxic to the kidneys.
However, all I know for private health groups, that's why it's so important to have an antibiotic stewardship system. They making sure that in all cases appropriate, especially we're reserving the use of carbapenem drugs, which kind of promote the growth
emergence of resistance.
The emergence of resistance. So in terms of what's being done, there's enough being done in terms of antibiotic stewardship, and especially this colimycin is a drug that's not registered in South Africa, so it's only used under authorization from the Medicines Control Council. So wherever it's needed, it's used, and we're trying to use it as judiciously as possible. But at times, I mean, there's certain things that are out of our hands. Resistance spreads with bacteria, and
so I mean, many people are carrying this bug now around the country because once you acquire this type of resistance, you can be carrying it around without knowing it doesn't cause any infection in some people, just like you're carrying bugs normally in your gut. And then you can spread it amongst your family members, and then somebody who may be susceptible to get an infection may get an infection with that particular bug, and then it becomes really difficult to treat. And you're right, brother, when they say we're going into a post-antibiotic era, it means that we may be reaching a stage where we will have many bugs for which there's no available antibiotic, and we'll have to rely on your immune system to clear that up. And that's well and good for most people who have relatively strong immune systems. It will be like the pre-antibiotic era. We'll be going back to like the 30s and the 40s, where minor infections used to kill some people because their immune system could not handle it. So make dua, inshallah, Allah subhanahu wa ta'ala finds a solution for us. Otherwise, the bugs will win this one. Do you agree?
Bugs are smart, and unfortunately, all the drugs that you bring, they've got ways and means of developing resistance. And
so I mean, we may have epidemics of patients with really simple infections.
Which we won't be able to find a cure for it.
If you have an ear infection and you can't treat it, the majority of people will clear it, but a small percentage of people may develop meningitis and severe sinusitis.
And this is going to affect especially the young and the elderly patients who...
those people. So we make dua that Allah subhanahu wa ta'ala protects us. There are some new antibiotics, not many, which have come out, nothing in the last 15 years. So they are repurposing some old antibiotics which were not used for many, many years because of side effects. And in fact, some of them are now more effective because they haven't been used for such a long time, like chloromycin and colimycin you mentioned, and we use phosphomycin and some other things like that, which seem to work now for some of these bugs. But it's a real difficult problem. So let's get back. So we were talking about the direct medicines issue. The second issue I want to talk about, we spoke about generics. And one of the big problems is that those direct medicines come to you, or you go to a pharmacy and then you get a bill for a co-payment. What is that co-payment about?
In fact, that's one of the reasons why it's very important that whoever has medical aid understands what their medical aid is offering them, what it's covering for. Because a lot of times,
so we need to wrap this up because we've got like 2 minutes.
So a lot of times patients misunderstand and they think, it covers everything, and then they either have an argument with the doctor or with the pharmacist saying that, my medical aid is supposed to cover for this. I have savings, I haven't used it for a long time, but the medical aid is not covering for it.
According to their rules.
So the medical aid rules will, in most scenarios, medical aids cover for, if there's a generic available, it will cover for either one or all of the generics that are available.
Many times the medical aid will have a formulary which is defined what you are allowed to get on that medical aid.
Yes. So I know a lot of times patients to read through that it's pages upon pages of medication.
So is to pick it up.
So the pharmacist, according to law, the pharmacist has to offer you a generic when a generic is available. And then it's the patient's choice whether the patient is going to take the generic or not.
And if they don't want to, then they may be liable for
that's when the co-payment comes along.
Or if they use out-of-formulary drugs, that's also when they have co-payments.
And I mean, one of the problems I have with medical aid is some of them don't cover pain medicines, they don't cover multivitamins. And I mean, multivitamins in general is not something which everybody needs, but there are certain groups of patients who benefit from being on them. But most medical aids will not cover that. And they won't cover supplements.
Yes. A lot of medical aids don't cover fully for a lot of the OTC medications that you can get your Schedule 1 and 2s. They'll want it to come out of your savings if you do have savings.
So it's been fascinating. I don't even think we've touched some of the issues in detail, which we could have had a whole show on about. And maybe, inshallah, we can have Huzaifa and Rosh back again, inshallah, in a few months to go through some more pharmaceutical issues. And just leaves me to thank you guys. It's been really fascinating, and Jazakallah for coming through and helping us on this topic. As usual, I wish that Allah subhanahu wa ta'ala grants every person out there who is suffering, who has any type of ailment, He grants them shifa. And we pray that Allah subhanahu wa ta'ala gives us relief as the Muslim Ummah around the world and grants us all success. Jazakallah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.